Okay, everyone.
Can I hit the cowbell?
Yes, that was going to assign you to that, Doc.
Sure, that'll be my job.
Okay. And we have until 5 o'clock for discussion. We have a couple of questions coming in over the web, and we'd like to include some of our observers who've been sitting at the back, but we are going to start with Dr. Gold, who's had her sign up, and I haven't been paying close enough attention. So please, you start.
I thought I'd talk about the diversity findings of our European colleagues and whether or not they're applicable to what we're trying to look at here. So our colleagues Erika von Medius and Charlotte Braun-Farlander and our Finnish colleagues did indeed find an association of diversity with protection against allergy and asthma, and but they've gone beyond this vague concept of diversity, and they've found cocktails from the stables and the barns that seem to, in animal models, be protective against allergy and asthma. But I think the warning from them is that the response is gene dependent, and so as we talk about core protective organisms, it may turn out that some people respond differently than others. And the other thing is that you may be able to have a dominant protective species as well as a dominant adverse species, depending on where the organism is coming from. At least that's our impression in some of our human microbiome work on fecal flora. And then I have a question that comes from my old-fashioned years ago experience with allergens, is that they vary so much spatially. And so do the environments of homes. And while I think it makes sense to conceive of having standardized methods for measuring the microbiome, the concept of a core microbes in the homes, unless they're all coming off of people who shed staph and strep, if they're coming from the temperature and humidity and housing situations that vary a lot, even across the U.S., won't the microbes be different?
Can I respond to that one? So there was a study recently by my colleagues Noah Fiera and Rob Dunn that extended what we did in 7 homes across the US on a longitudinal scale to, anyone remember, was it 200 homes? 1,000 homes. And what they showed, interestingly, as a catch-all, was that the bacterial communities were all home-specific, but didn't show any significant regional variation. It was only the fungi which showed specific regional variation. And what's it? We've done some mapping of that, and you can map some of those fungal regional variant patterns onto certain comorbidities associated with the human populations in those different districts. So that's just a fun side point. But there's indications to suggest that fungi could either be co-correlating or potentially even related to certain clinical morbidities.
Katie, you want to bring in the questions? I guess one's from Hal.
Yeah, although I might start with one from Lou Harriman, who had been watching some of the presentations on the web, and I'm going to try and paraphrase this. So he had asked, bridging the deep chasms of understanding between the building professions and academic disciplines has always been a major challenge. I wonder if it might be useful to consider funding the development of quantitative means and methods of measuring information transfer. So actually this fits in really well with what we've just been speaking about, between researchers and practitioners, in this case between biologists, indoor ecologists, and building architects, engineers, and owners. Without the feedback of quantitative measurements, it seems doubtful that we can even know if information is flowing, much less to what degree any information flow has been effective in improving professional practice. And again, kind of talking about the role here of well-known and well-proven quantitative tools and techniques in the science and engineering community. So I think that this is fitting in really well with the discussion, and I don't know that's exactly a question, maybe more a perspective from someone coming across the web. Let me actually, I guess, then just take 1 second to also raise Hal's question. And now I've got to find it. So maybe go on to one more and I'll pull that one up.
Okay, we're open for discussion, and as I said, especially participants who haven't had a chance to say anything, who are mostly sitting along the wall, and we have a microphone, and when you speak, we'd appreciate if you'd start by identifying yourself. Yes, sir.
Thank you. My name is Mike Broder, EPA, but again, these are my opinions and my opinions only. I mentioned this to a couple of people going forward, but it seems to me that one of the things, I've seen information flow back and forth, to start with developing a very general conceptual model, trying to identify what the question is. And what I'm picking up from this area is that there are enormous numbers of unknowns. And I think that by starting out, number one, with a conceptual model, what is the question we're trying to answer? What are the variables that play into this? Moving that forward into a semi-quantitative area where you can actually do some level of sensitivity analysis, identify those variables, and then move forward. Now, at this point in time, I guess that's the job for tomorrow, which I will not be here. But, it seems to me that there was some very nice discussion, but people are kind of floundering as to how to address that. And I think this pretty much falls into line with the planning and scope and problem formulation that we've tried to use in a number of EPA programs.
Thank you. That's a very useful suggestion. Okay, we've now located Hal Levin's question.
So he had a couple of very specific questions, and I think they relate to following up with the speakers in a couple of cases with Gary and with Yelena on some of the specific references to the data you showed. So what maybe we'll do is try and follow up with you later. So for instance, Yelena, I think Hal was very interested in the data about the results that you showed on indoor air quality and the rates of cold infection or upper respiratory diseases. And so we can, I think, follow up with you later to get that. And similarly with Gary, I think Hal was really interested in what you mentioned about treating newborn babies with a sort of a cocktail of microbes, which I think might be referencing Jill Banfield's work. So. Okay, well, whoever that was, we'll follow up afterwards to get the actual paper. Okay.
Okay. Discussion. Is everyone worn out? Okay, yes, please.
Just maybe a comment to get us started. We've had presentations on and discussions about air and waterborne or water-related microbials and the impact they might have as pathogens. We haven't talked about the more classic surface, contact exchange, and we also haven't talked about the impact of soils, and with soils come food, and whether are we going to actually try to make an attempt to sort of delimit the scope so that we don't end up talking about contact, because there are lots of studies that have looked at
it's part of our charge is to decide what we're going to delimit and what we're not. And so this is very much an open and let's feel around feeling, but it will be part of our charge. I don't see any need to exclude something is important, that especially since there's a lot of historical data.
Yeah, so, as I mentioned before, so what really we need to define what means building environment. So we need to define here, so then we know what we should include here, what should not include here. Maybe this is a very important issue. What's the definition of building environment?
I think that's reasonably well. I mean, we could define it arbitrarily however we want to, but any environment that constitutes the majority of that ecosystem being of human origin. So indoor environments can suit that, but also outdoor environments. I mean, we could decide whether we want to stay with indoor or outdoor, but a city, a parking lot, even a wastewater treatment plant. We were talking about that earlier.
Yeah.
All of those have indications towards a built ecosystem.
So how about the reservoir?
Yeah.
So this all building environment?
Well, part of it is. Most of it isn't. The dam bit is. The rest of it is a human constructed ecosystem, but not necessarily a natural environment.
But I had brought up earlier, were we going to study manufacturing, food, agriculture environments, and people sort of seem to feel not. But so, traditionally people talk about the built environment. It's non-agricultural, non-manufacturing environment. So that's what most of these reports have always been on. So it's a very good point. I'm not saying we should or shouldn't, but we need to define it.
As chair of the committee, I have to say that my own perspective is that we shouldn't be so much focused on the where of data gathering, but that we should be looking at a slightly more meta position, and we could get hung up forever saying, are we going to collect data from ag environments or from reservoirs, or which is which? And I think we should be trying to look at higher order concepts, but I'm supposed to be evoking that from the conversation. Paula, did you have a question?
Actually, I had a number of comments. First of all, I'd say probably more than half of our grantees are taking surface samples. So there is a lot of work done on surfaces, and I'm sure Jack could speak up about their work. We haven't spoken much about the building science measurements. There's an extensive paper that was part of the Hospital Microbiome Project. On those measurements, there is two now, all right. There's also the built environment package as part of the Genome Standards Consortium. So there's a lot of work out there, and maybe these are in your background materials, but in terms of, I think there's been a heavier focus on the life science side here, but the building science side has to be, again, very well represented, because if we're looking at buildings as ecosystems, the building is doing a lot of things for us, and as Elena pointed out, the operation and occupancy of the building is doing a lot for us also. So just the when we started the program, we started with life scientists for a reason, but that was 10 years ago, 11 years ago. So, and again, you have some very good people around the room who know about buildings. So I just want to make sure that we remember its importance about the buildings. And we're studying an invisible world.
So I guess this gets to scope as well. So we've heard a lot about bacteria, and we know there's a fair amount of bacterial data. A bit about fungi. I think one mention of viruses. Zero about protozoa. My question is, A, the relevance of protozoa, and somewhat related to that, now when I start to think about the issue of mechanical ventilation versus natural ventilation, how about vectors?
I'll chime in terms of some of the work that Amy's doing, because we've funded more work on sort of air and surfaces than in water. But Amy is getting into that, and I think other people in the field. So I think it's important because you have to remember it's an ecosystem, whether it's in the reservoir or in, you know, the pipe that's in my apartment on the 14th floor of New York, in the pipes there. And so, and I've had my shower heads tested in Norman Pace's study, so I actually know what's in my apartment, but I haven't changed anything.
Well, but but I think it actually goes beyond the protozoa that Amy is looking at. For example, there was a study recently, I recall, looking at pathogenic protozoa in the outdoor air in Mexico City. And clearly, with what we know between outdoor and indoor exchanges, in some circumstances, you know, indoor pathogenic protozoa could be relevant, Giardia and Cryptosporidium and Entamoeba, for example.
And right, and I'm looking at that, but not as work in this particular program.
So what I would add to that too is that protozoa look to be very important, but one of the just mechanical difficulties of working with them is you can do good biomarker studies with protozoa, but their genomes are so large that, you know, sometimes hundreds of times larger than human genomes, that it's really difficult to do some, you know, other than just basic kind of a census type of questions. It's hard to really, you know, even distinguish pathogenic from non-pathogenic protozoa.
I'd just like to throw in about when people talk about the health impacts of mechanical ventilation, they do tend to forget that before mechanical ventilation, a lot of the South was malarial. So that gets to your point of vectors.
I would also mention that, again, from a different community perspective, we spend a lot of time working on fundamentals of energy on-site production, analysis, and so on. We optimize everything and so on. After 20 years of very hard work, we realized that occupants threw off everything. and everything that we were doing was in the range of noise. I mean, a lot of broken hearts and missed opportunities. But so I would just argue here that if buildings are not taken into account, there could be many wonderful results, but also many missed opportunities. If I understood, it's from research to application. And when you would like to do some intervention, that would really involve building, and it's unavoidable.
I agree with you quite strongly. And if you, for example, do some work with any school system now, when they're financially tight, they're trying to use less energy. They've got fewer air exchanges. Every school is different. They don't change the filters, and there's a lot of goodwill. The engineers really want to improve health, but they're under a lot of constraints.
That one, okay.
Want to do some introductions as a self-introduction?
I'm Bob Holt. I came in late. Sorry for that. I'm a professor of ecology at the University of Florida, and I'm a bit of an outsider. I don't really work on microbiomes. I work on general ecological theory. I have a couple of general observations. One is stimulated by, these are great talks, by the way, but Amy talked about some very nice experiments she had done, and we are talking about built environments, and I think there's probably a tremendous opportunity for comparative experimental microbiome ecology over ranges of gradients, rural to urban gradients. It might be difficult controlling for people, but one problem with just straight up observational comparative studies, there are always a lot of hidden correlations that you may not really understand. That's the first general comment, and maybe we could have as part of our report a call for this kind of systematic study. The second is, I agree with what Charles was just saying and others about increasing the taxonomic scope. Protozoa, viruses, and so forth are incredibly important. But it's not just a list of species, it's a set of interactions among species that matter. So you think about this, you should think about it sort of like a food web or a network of interactions, and you perturb one part of the system and you may get surprises because other things spring up. So by analogy, if you think about harvesting the sea, there have been a lot of disasters in harvesting because people manage single species of fish, but actually the fish are eating each other, competing with each other, interacting in various ways, and so when you over-harvest one species, you will perturb an entire community and there will be surprises elsewhere. So that to me seems to be a large unknown in this arena.
Another comment in terms of the charge and what we have to deal with in terms of talking to the public about what to do about their buildings. Pets, pests, rodents, they're going to happen. And we need to deal with them. And, there's a concern about what other things they're introducing into the indoor environment, the rodents that may be carrying hantavirus, the parrot that I may or may not have that's Lord only doing who knows what to my indoor microbiome. So these are all parts of things that we have to deal with in real buildings and the things that people do to defeat the controls that we've created to make the building operate in the way that the designer perhaps thinks is ideal, but when the cold air is blowing on my head and I don't like it and I block the vent, or when the squirrels have nested in the attic. So there's an element of reality, of really understanding real buildings and real building science and why theoretically well-designed buildings have failed, huge failures in building systems that we need to also take into account.
Other comments?
If I can jump back in, I'm working on an outline here to try to understand how much of the built environment we would have to address. And it strikes me that if we're looking at sort of bacteria, fungi, protozoa that is being transferred either through the air or through water or on surfaces and possibly through soils and ingestion, that you probably need to at least treat the built environment as a system with air and water transport, because it sounds like the source of water is the worst problem. And then it gets a little bit less urgent it matters, but it becomes maybe less urgent. That if we are going to touch soils and food and ingestion, we're looking at the sites around buildings, the immediately adjacent sites, but not necessarily agriculture or large scale. And then buildings themselves and the occupants of buildings and the pets and the pests and the rodents who are also occupants of buildings and what they... So it does sound like we could circumscribe, and I think I would like to suggest that we at least hold on to homes, offices, hospitals, and schools, and that we leave maybe everything else, at least those four, because I think they each pose very different challenges. Just a thought.
I'm sorry, someone by the wall whose name I do not know.
Tom Cutter, I'm an independent contractor. At what point in the building do the normal bacterial control mechanisms, like phages, colicins, antibiotics, cease to function? Are they active on the table in front of you right now?
So,
or are they inactive?
I can answer that to a certain extent. We've done extensive work in restroom environments looking at phage bacteria.
Too moist.
Well, it's an interesting point. So even in that moist environment where you have active bacteria that are actively forming cysts and surviving, you have very, very, very low phage interaction, suggesting the majority of those bacteria aren't the phage can't get to them, or the phage aren't interacting with them in the same level.
Mycotoxins or antibiotics from the fungi, the Streptomyces.
Yeah, we don't see a lot of fungi in the immediate after sterilization. So we sterilize the environment completely, and then we look at bacterial ecosystem succession and viruses as a component, or phage as a component of that control mechanism in a Lockwood-Volterra style systems biology model. And we don't see the fungi as being a significant role in shaping that successional development in that environment. It's definitely important in other environments, but I would argue that the vast majority of bacteria we see in these environments are dead or inactive, and therefore phage don't play a significant role in controlling the ecology of that system because it's not active enough to allow for phage control. And this comes to the ecology as being the principal component of importance in understanding that, not just at the level of the surface, but at the level of the entire system.
You've been talking about bacteria. Are archaea important?
Yes, there are some there, but not a lot of them. In some of the more anaerobic surfaces, you find in environments which are either completely moist and therefore devoid of oxygen, you start to see an increase in some methanogens, but it's limited.
And then if we're going to look at protozoa, I encourage looking at mites. They're kind of the top predator for bacteria and fungal spores in most built environments. In fact, right now under your feet, there are thousands screaming from the fact that you're standing on them.
Good. I'm not sure mites can scream.
Yeah, so one problem is when you get it to mites or the higher organisms, the sample strategy quite different. Okay, when we do the bacteria, we only get very little tiny samples. So you can look at it, diversity, you can look at activities. When you get higher, you can use large volume. You need sample it, even for soil. So the sample strategy quite different. It's not feasible to compare each other. It's very hard. So because the animal moves, it's not easy to compare each other.
Because it's those mites that are often some of the allergens that people are already.
Yeah, like mites, like nematodes, like the Protorua, Protists. Yeah, so all like the arthropods, because the sampling strategy, so the size of the sampling is quite different.
Thank you. Jean?
It's probably stating the obvious, but I'm with Ben, is it? That health, from where I come from, that the health must be an important driver from my point of view, from my agency's point of view. And I think it speaks to the ecology and understanding the ecology, because obviously it is mixed exposures in the indoor environment that we need to understand, and how interactions amongst these things like the inflammatory effects, allergenic, infectious agents, neurotoxic effects. So from my point of view, it's fascinating to know about the microbiome, and you guys work on that. But I'd really like to make sure that we bring in the complexities of the health effects and how the ecology works on all of them.
Anyone wanting to simplify some of these variables that we've been putting on the table? Okay, Jordan and
I really like this discussion about ecology and ecological processes, and I think that is an obvious and very good framework to think about many of these questions. I have some sense that many of the ecological processes that we attribute to occur in soil and water and other environments probably may not be important here, but it's something that we should look into and sort of figure out what's unique about the ecological processes in the built environment. And I think that's a nice and appropriate way to frame many of these questions.
Yes, Tina.
I embrace the complexity, and I think that needs to be articulated, but at least from this funding agency's perspective, what is going to be useful is not for the committee to think that they have to answer all the questions, but help us prioritize the questions that need to be answered in order to advance the mission of the study. I'm going to take away your recommendations and develop some research in-house. I'm going to be looking to develop, more importantly, some RFAs that's going to inform future research directions. So keep that in mind as you sort of identify, what are the things that need to really be done first and really need to be addressed in order to make a dent on this very complex area.
Thank you.
I'm thinking back to Dr. Schrebrick's, and I hope I got the pronunciation close, presentation. That really a key aspect is perception. How are people perceiving? And using that as an index of health outcomes. And so I think there's a missing gap there in trying to understand all the factors that lead into people's perception of a particular habitat being less desirable or more desirable. And so I think, that's probably worth drilling down a bit as we go through this, if that sort of observation is replicable in other venues.
I'll just remind you that perceptions are not actionable. So if you can take that a step further to quantifiable perceptions, maybe.
So,
Which she started.
can I take this a little farther than perception to cognition and behavior, which is an outcome that a lot of people are now trying to measure in relation to environmental exposures?
Yeah, to get back to the buildings again, it's clear, we're going to have to, if not limit the scope, certainly define it. Fortunately, we don't have to do that this afternoon. In terms of the building type, while most of the discussion may be about homes, hospitals, schools, and offices, I would hate to limit the building type prematurely. I think about public assembly spaces where you have huge numbers of diverse people moving in and out, the retail we heard about earlier. So, that's just one thought bouncing around. Fortunately, other people have done a really good job defining building types, so we don't have to do that. And I can share that with the group at the right time. Another point, I guess related to buildings, is there was some discussion about communicating with the public, and that relates to people in their residences and in their offices. There's also needs to be communication with the stakeholders who design non-residential, who design and operate non-residential building, which is a very different group of people. They're regulators, they're designers, they're equipment manufacturers, and the people who own and operate non-residential buildings is a whole different means and mechanism for communication that we need to keep in mind.
Thank you.
Task does not, and I was looking for any suggestion about perception, cognition, anything in there that is completely absent here. So I hope we do pay attention to that. Thanks.
Yeah, if there's one word that the military would use, it would be human performance.
Boats are a built environment.
Okay, another comment from Dr. Holt.
Yeah, I was just, let's not forget the aquatic realm. Ships and boats are important, and they may be good test ground for lots of ideas. And I came across some facts recently about buildings, which is, of course, buildings have a life cycle, and they're a lot shorter than a lot of people think. In Canada, for instance, the average age of non-residential buildings is less than 20 years, which And there's a successional dynamic that almost surely takes place after a building is built that goes on to the present. And so one thing that could engage with the building sciences is not just the materials of the building, but things like how big is the building? What is its situation in a landscape? Can you quantify the surrounding landscape? What are the entry points? We were talking about, airflow, but people move in and out. People take their pets on walks. What is the net that's cast by the occupants of the building on the surrounding landscape? And what is the effect of the lifespan of buildings? If are you dealing with new structures, with old structures? Is there a progression in the microbial communities that assemble and disassemble and so forth? And that may be one way of helping organize in a sort of a meta-analysis way among many, many different studies, is to think sort of systematically through the structural components of buildings and how they could be influencing microbial assemblages.
Trying to talk to that quickly. I love everything you're saying, Bob. It's brilliant. The one key thing is, and Paula brought this up, is the sensor development that would be required in order to make those detailed observations of activity, of proximity, of all of the other components can influence what happens inside a building. And it's whenever you're an architectural firm build a building, and we work with Skidmore, Owings and Merrill, for example. They make a lot of predictions about activity and usage based on some internal studies that have been done on over the last 50, 70 years, whatever, that detail how people actively use their spaces, but not a lot of them ever follow up with predictive estimates of how those buildings are actually used. And most of the studies that do it are sociological, not necessarily quantitative estimates of actual usage structure within a system. And that's changing. That dynamic is changing at the moment, and there are a lot more studies coming up because it's now becoming self-evident that human health could be implicated by how the building is used, not just how it was intended to be used. But I think that's a missing gap in our understanding. You're absolutely right.
And I just want to chime in, Jack, I don't know if you remember when you were studying the hospital, I was wandering around with the building scientists. And when they started making their measurements, they were working very closely with the environmental and cleaning people who really controlled the building. And the people in the building said, oh no, your measurements are wrong because there's a code in terms of how the building's supposed to operate. And it turned out that the measurements that the people making the measurements on Jack's team were making the right measurements. So they had a good relationship with the people in the building so that they could then make the adjustments so that the hospital was, operating as it's supposed to. But there are lots of things that we just don't know. We're studying wineries and cheesemaking facilities in California. And what's interesting there, as interesting as the microbiome work is, because you need microbes to do fermentation and you don't want microbes to spoil your wine or spoil your cheese. The dairy and winery owners are very interested in the actual measurements of the building science measurements, because they never had this level of detail about what's going on in the winery so that they can, again, make different choices. I think there's the assumption that you build the building and it's so many air changes per hour and whatever, but again, maybe it's not. And so there's really a lot to be learned about the buildings and how it impacts on the occupants and their microbiomes.
I would concur that the wine and cheese work is some of the most important work being done in America right now.
So we may not do all agriculture.
And I enjoy the site
vineyards.
visits.
I think we should define the built environment as a beer house or
do we have Andy still?
Okay, Andy, are you, okay, Diane. Okay. Well, there's no rule that says we have to go until exactly 5 o'clock, and so if there aren't any more burning questions or comments, I would suggest we wrap up and congratulate ourselves on having opened 1,000 new questions. Thank you all for your comments, your input, and for your active listening.
And actually, just before we adjourn, one very quick logistical note for the committee members, because I think it wasn't quite as clear. We do have a committee dinner scheduled for you all. If you have made other plans, then obviously you have made other plans, but we would welcome you all to the committee dinner. It's at La Chaumière, and we'll either walk, since it's a nice day, or we can take taxis over there as folks prefer. And of course, as Joan was saying, thanks very much, obviously, to all the sponsors for the study and also the speakers and our other guests and observers who were participating in the discussion. I think it did just add about 57 more bullets to the committee's potential statement of task, but happily we can try and figure out a path through that in our discussions tomorrow, with which is kind of closed and it's just kind of committee only, so we can figure out how we're going to approach this daunting challenge. Is there anything else? Well then, thank you.
Yes. Let us adjourn.